better than cure. So what are the things that we learn? Make a nick in the center, aspirate out that liquefied cortex so that you have debulked it and made the convex anterior capsule either concave or on a horizontal plane. Make a small rhexis first so that chances of it going out are less. The more peripheral you go, more chances of it running out. So you make a double rhexis. Most often it's always better to make a double rhexis once you have debulked, removed all the liquefied cortex and complete the rhexis like this. Another take home message: always stain your capsule in these kind of cases so that you can see better. Well, in this particular case I found that the second rhexis also was a little small, so I have done a triple rhexis in this case, where I've gone in again at the end of the procedure, made sure that the rhexis is of a good size, and this was also a patient who had a diabetic retinopathy in the other eye. So I made sure that the capsule is big enough so that tomorrow when we need to go in and do any retinal procedures, it will help our VR surgeons. So here you have a nice round rhexis which is about 5.5 millimeters, and this is how it helps us to make sure that we don't have a runaway rhexis. Another poor man's femto Rhexis is the Zeptorhexis, which is another tool to prevent this kind of runaways in these intumescent cataracts. And you can see here there's a nice round 5.2 mm Rhexis. And the other thing about the Zeptorhexis is the edges are rolled out, so the chances of it tearing even when you're doing a phaco are very less, because these capsules are otherwise very thin. So this is one additional advantage of doing the Zeptorhexis. Now our very own Dr. Mohan Rajan has shown us the Punctorhexis, which is low about 30 to 40 power, burst into the center, and then you continue the rhexis like this. So this is another thing. And here I would like to show you all. I do this in all my cases. I go in closed chamber, except for intumescent cataracts, because you need to stain, you need to make your side ports. But otherwise, in all cases other than intumescent cataract, this is something that I follow, and in all my cases, and I have beautiful rhexis because I go in closed chamber. But when we are bending the needle in these cases, we have to make sure that the needle is not 90-degree or even 45-degree bend. It has to be a very, very small bend. I'll try and show it to you all here. A very small bend, maybe just about 10 to 20 degrees. And you can see here, it's hardly any bend. It's only to be able to hold the capsule when you go inside. But otherwise, the reason for this is to be able to go in very easily with your needle and have a nice closed chamber. And this is not edited. The rhexis goes like this, perfect, round, no problem. In all cases, I do this and I have found it to be very, very useful to me. Thank you so much.